hair loss is a normal physiological phenomenon in the human body. However, when the amount of hair shedding increases noticeably or persists over time, it may no longer be a simple cosmetic issue, but rather a sign reflecting underlying health conditions. It always has a medical cause. It is only a matter of whether you have recognized it or not. 1. When is hair loss considered abnormal? In healthy adults, hair grows in a biological cycle consisting of 3 phases: the growth phase, the transitional phase, and the resting and shedding phase. The normal physiological rate of hair loss is approximately 50 to 100 strands per day. However, hair loss is considered abnormal when the number exceeds approximately 100 to 150 strands per day and persists continuously for several weeks. In addition to quantity, the pattern of shedding is also important. If hair falls out in clumps during washing, or even when lightly running fingers through the hair, this indicates that the hair growth cycle is being disrupted. Another important sign is the gradual change in hair density over time. When hair not only sheds excessively, but also regrows poorly, the scalp becomes visibly thinner, especially at the crown or along the part line. This is considered more important than the daily amount of hair loss, as it reflects the regenerative capacity of hair follicles. 2. What is the body signaling, and why? Hormonal imbalance. When hormones change, the hair cycle may be shortened or synchronously shifted into the resting phase, leading to hair loss. In postpartum women, a sudden drop in estrogen causes many hair follicles in the growth phase to simultaneously enter the shedding phase, resulting in diffuse hair loss during the first months after childbirth. During perimenopause and menopause, decreased female sex hormones reduce hair density, making hair thinner and slowing regrowth, leading to a progressive perception of thinning hair over time. In addition, thyroid disorders such as hypothyroidism or hyperthyroidism can also cause diffuse hair loss due to their impact on overall metabolism. Patients often present with symptoms such as fatigue, weight changes, abnormal heart rate, or changes in body temperature. Another condition, such as polycystic ovary syndrome, may increase androgen levels and lead to male pattern hair loss, typically noticeable at the frontal and crown regions. Nutritional deficiencies. Iron deficiency is the most common cause, particularly when serum ferritin levels are low. Iron plays a key role in oxygen transport to hair follicles. Therefore, iron deficiency leads to weaker and increased hair shedding. Zinc deficiency affects cellular division in hair follicles, slowing new hair growth. Protein deficiency reduces hair shaft quality, making hair thinner and more fragile. Vitamin D and B vitamins such as B12 are also associated with disruptions in the hair growth cycle. In these cases, the body prioritizes vital organs such as the heart and brain. While hair is one of the earliest structures to be affected, stress and neurological factors. When stress persists, cortisol levels increase and affect the hair growth cycle. Under stress, many hair follicles synchronously enter the resting phase, and approximately 2 to 3 months later, diffuse hair shedding occurs. This is commonly seen after prolonged insomnia, severe psychological stress, major illness, or high fever. Scalp disorders. Seborrheic dermatitis may cause increased oil production, flaking, and itching, reducing the quality of the environment surrounding hair follicles. Fungal infections of the scalp may lead to patchy hair loss due to structural damage to hair follicles. Psoriasis of the scalp causes thickened skin, interfering with normal hair growth. Medication side effects. Certain medications may cause hair loss as an undesirable side effect. Common groups include anticoagulants, chemotherapy drugs used in cancer treatment, and certain hormonal or neurological medications. Hair loss in these cases often depends on the type and duration of medication use. 3. Associated symptoms that should not be ignored. First, if the patient experiences persistent fatigue, reduced energy, increased sleepiness, or difficulty concentrating, this may indicate anemia or metabolic disorders. When the body lacks oxygen or essential micronutrients, Hair follicles are among the earliest structures affected, resulting in diffuse hair loss. In addition, if the skin appears pale and nails become thin, brittle, and easily breakable, this is a typical sign of iron deficiency or prolonged micronutrient deficiency. When hair loss is accompanied by menstrual irregularities or noticeable hormonal changes, endocrine causes should be strongly considered. Unexplained rapid changes in body weight, either gain or loss, require evaluation of thyroid function or systemic metabolic disorders. The thyroid regulates metabolic rate. Therefore, dysfunction often presents early with hair loss. In cases where the scalp shows itching, redness, flaking, or persistent discomfort, dermatological conditions such as seborrheic dermatitis or fungal infections are commonly involved. Notably, if hair loss occurs in well-defined circular patches, autoimmune conditions such as alopecia areata should be considered. In addition, symptoms such as palpitations, tremors, anxiety, or excessive sweating may also be associated with thyroid dysfunction, particularly hyperthyroidism. 4. Silent habits that worsen hair loss. Improper hair care practices can weaken the natural protective barrier of the scalp. Washing hair too aggressively or using excessively hot water over time removes the scalp's natural oil layer, leading to dryness, irritation, and follicular weakening. In such conditions, hair becomes less stable and enters the shedding phase earlier than normal. Combing hair while it is wet is another important factor. In the wet state, keratin structure becomes softer and more vulnerable. Another common factor is prolonged traction on hair follicles, such as tight hairstyles, tight braiding, or long-term hair extensions. Continuous tension impairs microcirculation around the follicle, which may eventually lead to traction alopecia. Frequent use of high heat from blow dryers, straighteners, or curling devices also contributes to loss of natural moisture. When the lipid protective layer is disrupted, hair becomes dry, brittle, and more prone to breakage. In addition, prolonged sleep deprivation disrupts circadian rhythm and affects hormonal regulation of the hair cycle. A diet low in protein and micronutrients reduces the raw materials needed for hair synthesis. Chronic stress increases cortisol levels, disrupting the normal hair cycle and accelerating entry into the shedding phase. 5. When to seek medical attention. Patients should seek medical evaluation when hair loss persists for more than 4 to 6 weeks without improvement. Medical consultation is also necessary if progressive hair thinning or visible bald patches appear. Medical attention is especially important when systemic symptoms such as fatigue, weight loss, or hormonal disturbances are present. The human body always has a way of signaling when something is wrong, but these signals are not always obvious. Hair loss is one of those subtle early warning signs that is often overlooked. In medicine, recognizing these small changes in time is sometimes the most important factor in protecting long-term health. I'm Monica Bellamy. Follow me to stay updated with useful health information.